Good morning everyone. I am Dr. Kailas Patil, knee and joint replacement surgeon at Sancheti Hospital. Today I'll be talking about total knee replacement. There are a lot of myths, there are a lot of presumptions about this surgery which is supposed to be a lifestyle surgery. It's supposed to be a life-changing surgery rather. In your older age, as you grow older, the knees get damaged, the knees get arthritic, and because of which you may suffer with a lot of knee pain, or rather a lot of joint pains which may be related to your knee, your hip, your ankles. But there is a very good option available nowadays which is called as a total knee replacement. Now the first thing which we need to understand is what is this surgery. This surgery, usually what the people's perceptions are is that you have to have the knee completely replaced, that is, remove the old knee and put in a new one. Well, that is not the case. If you look at it word to word description of a knee replacement surgery, it's actually a surface replacement surgery. So what we exactly do is remove all the damaged surface of the knee and put in caps on it basically. So that is what is knee replacement surgery. It is not really knee replacement as in changing the whole of the joint, it's just removing whatever is damaged. So that is the first myth about this surgery. Second myth is, a lot of times people think that after knee replacement surgery, will I be okay? Will I be able to walk normally? Will I be able to squat? Will I be able to run, jog? Well, you can do all of these things, but in a little limited fashion. It's not going to be your original knee, no matter how you do it or where you do it or what technique you use it. It's always going to be an artificial knee. So it has to run for a longer time, so we need to take care of these things, and with limitations you can do all of these things which I mentioned earlier. Now the third thing is, people need to understand what is knee replacement surgery. So I'm just going to show you what it is going to be. So if you look at this model, this is your knee. So this is where we cut the knee open from, and these are the components of the knee. So as I mentioned earlier, so this is a surface replacement surgery. So what we do is take off all the damaged surface and put in these caps which are fixed to the bone with bone cement. Now the second thing is this side, that is the tibia or the lower bone. This is also only the portion which is damaged is removed and new kneecap is fit above this. And after this, these starts functioning like a normal knee. So this is what is called as a knee replacement surgery. So it is not where we are going to remove everything. Fourth thing is, will I be able to squat over a period? Yes, you can very well squat, provided that you are doing very good physiotherapy, you are strengthening your muscles well, and you are listening to all the precautions and physiotherapist advised which has been given to you. Third thing is, doctor, is it going to be a surgery where I am going to require a lot of blood loss, or is it going to be I'm going to be cut open quite a lot? Well, no, that is not the case. Nowadays we do it through a very minimal incision, and there is not going to be too much of blood loss because we use certain medicines which will reduce the blood loss, plus the surgery time has reduced. It takes hardly about 25 to 30 minutes to replace the knee joint. So that is how quick this knee replacement surgery is. Now the fifth thing is, whenever you are going to be in your normal life, will I be able to walk? Will I be able to run? Will I be able to go to my normal work? Well, yes, you can do all of these things, but only you need to give it a little bit of time and a lot of exercises. So that is what knee replacement surgery is all about. So second thing is, surgically, it's a procedure. It is going to be where there are going to be stitches, where there are going to be dressings. All these things you have to understand, and this can help you go ahead with this surgery. There are a lot of fears about this surgery, that you have heard that certain relative of yours or certain neighbor of yours has got this surgery and he did not get that much amount of benefit. So let me clear this, that any surgery for that matter, whether it is a knee replacement surgery, whether it is a gastric surgery, whether it is a gynecological surgery, all the surgeries are not foolproof. There are going to be certain issues, but they are very limited. Well, in knee replacement surgery, the amount of failure rate is almost 0.1%. That is very, very minimal. That is, if you take about 1,000 patients, one odd patient is going to have some issue. Well, if he has issues, do we address it? Yes, we can address it. We can go ahead and redo it and we can put in a new joint, or else we can do certain procedures which will help it to get back to normal. So there is nothing to be fearful of this surgery. So I would recommend for all of you people to talk to your doctor first, get to know about the surgery, get your perspectives clear about the surgery, and then with an open mind go ahead for the surgery. So whenever I tell my patient that you need a knee replacement surgery, I always tell them it is not the relatives, it is not the friends, it is not the family members who are going to be undergoing the surgery, it is the patient who is going to undergo the surgery. So the patient has to be mentally prepared to undergo this surgery. When he says, yes doctor, I will get this surgery done and I will become okay, only then I go ahead with the knee replacement surgery. So that is how a positive attitude towards this surgery is going to help in a positive outcome of the surgery. Thank you all of you.